Do you recognize that document, doctor? Yes, I do. Would it be fair to state that that document is a return of $3,000 to the credit card company of the decedent? Absolutely. Plaintiff's counsel, I'd like to offer that document in evidence, Your Honor. The court, fine. Defendant's counsel, no objection. The court, without objection. I would like to revisit, with the court's permission, the area in which we had discussed the anti-embolism stockings. And you said it was not your practice in your office to use them. Do you remember saying that? Yes. Would you state, doctor, or disagree that a patient who is 66 years of age undergoing an operation has a greater chance of developing a pulmonary embolism than one not having surgery? The court, that's a generic question, I assume. Plaintiff's counsel, a general question, Your Honor. A general question that a 66-year-old woman undergoing surgery of any type has an increased ability to develop a thromboembolism than somebody not undergoing surgery. Is that the question? I did not say thromboembolism. I said a pulmonary embolism. Pulmonary embolism? Yes. You mean under general anesthesia, not local? Forgive me for being pointed. I apologize, doctor. Does a patient who is undergoing an operation generally have a greater chance or an enhanced chance because of the surgery to develop a pulmonary embolism, in your opinion? The court, it's a general question, doctor. If you can answer it, fine. If not, say so. Well, I think I can, theoretically. Okay, would you agree or disagree, doctor, that a person who is undergoing anesthesia, who is 66 years of age, has a greater chance of developing a pulmonary embolism than one who is not undergoing surgery and taking anesthesia? General anesthesia, absolutely, yes. The court, we're talking about generally. Plaintiff's counsel, any anesthesia. The court, all right, go ahead. Including the anesthesia that you administered. I think it's the same question. Is it not the same question? It seems like the same question you just asked. I'm asking you with regard to anesthesia, doctor. Does a patient who is undergoing anesthesia have a greater chance of developing an embolism to the lung because of the administration of the anesthesia as compared to a person who is not undergoing anesthesia? I don't believe for local anesthesia that is true. I absolutely agree that it is true for general anesthesia. You are classifying your anesthesia as a local anesthesia, doctor? Local twilight, yes. It's called neuroleptic. The court, we are talking about the anesthesia administered to Rose, are we? Plaintiff's counsel, yes. You are saying that does not increase the chance of a pulmonary embolism in a patient who is 66 years of age? I don't believe it does, no. And with regard to a patient who is recumbent substantially, for the most part, of 15 to 17 hours of surgery, who is 66 years of age, would you agree or disagree that that patient is not prone to develop a pulmonary embolism than one who is not recumbent for 15 and a half hours after surgery? I would agree with you. You would agree that she would be more than, just a moment, more prone to develop a thromboembolism or pulmonary embolism, yes. Is that your opinion? Yes. When you were talking to us about the conversations that you had by telephone while Adele was in the car, something bothered you and you would like to bring it out, would you, sir? Defendant's counsel, Your Honor, I'm going to object to the comment. The court, yes. Defendant's counsel, I apologize for that. You had indicated to us in the telephone call, that second telephone call, that you wanted the nurse to loosen up her bandages? Correct. Isn't it a fact, sir, that the patient had a facial cast on? No. Not at all. It was not a hard case at all. It was not a hard surface. Somebody has ever put a hard surface on a post-facelift patient ever? I'm asking you. No, she did not have a cast. Because you don't know? Because I don't know that. That's totally inaccurate, is it? Well, no, the dressings, if I might, just for the benefit of the jury, because they are important. Excuse me, don't address the jury. It's not your role here to do that. I'll explain to you. It's a soft wad made of cotton. It's as soft as cotton. It is cotton. That's all it is, with an ace bandage, which we are all aware of for knee injuries or any sort of ankle injuries. That's all that was. No cast at all. Bear with me one moment, doctor, please. Doctor, one last question. When you spoke to one of the daughters on the phone on at least the first occasion or conversation, you said you had gotten the impression that she was not overly concerned about what was happening in the car with her mother. Is that correct? That was the first conversation. Do you know which daughter that was? No. And when you say she was not overly concerned, what is your opinion? Is that not so? Absolutely. Can you tell us what your opinion was based on? The first conversation was a relatively mild conversation. She was kind of complaining that the dressing was tight and a little bit anxious. And that's what the daughter said? That's the combined conversation. Excuse me, doctor, don't talk about what the nurse said. She's not here.